inside the rectum and the colon for polyps and abnormal areas, or for cancer. A colonoscope is inserted through the rectum into the colon, and a colonoscope can view more of the colon than a sigmoidoscope, and that's the advantage to this particular test. And there is some clinical evidence that women may be more likely to develop polyps in the upper colon, and this test is better able to view that area. The recommended timing for colonoscopy is every 10 years. And let me just also say that all these recommendations for timing are really based on the fact that nothing was found in the previous testing. So again, for folks without other risk factors and who have had negative screening tests, that would be the timing recommended. So new tests are being studied in clinical trials all the time. A couple of them include virtual colonoscopy, which is a procedure that uses a series of x-rays called computed tomography to make a series of pictures of the colon. A computer puts the pictures together to create detailed images that may show polyps and anything else that seem unusual on the inside surface of the colon. This test is also called colonography, or CT colonography. Clinical trials are underway comparing virtual colonoscopy with commonly used colorectal cancer screening tests. Other clinical trials are testing whether drinking a contrast material that coats a stool instead of using laxatives to clear the colon shows polyps clearly. Another test being reviewed now in clinical trials is the DNA stool test. This test checks for DNA in the stool cells for genetic changes that may be a sign of colorectal cancer. Now, the U.S. Preventive Services Task Force that makes recommendations on many of the screenings that we get today says that the evidence is insufficient to assess the benefits and harms of these new tests at this time, so you probably will not see those as recommended by your doctor at this time. Decisions about screening tests can be difficult sometimes. Not all screening tests are helpful, and most have risks. So before having any screening tests, you'll want to discuss them with your doctor. It is important to know the risks of the test and whether it has been proven to reduce the risk of dying from cancer. The risks of colorectal cancer screening tests include the following. Damage to the colon can occur. So infections or tears in the lining of the colon can result from sigmoidoscopy and colonoscopy, or the removal of polyps that have been found in screening. It is very rare, and it has been shown that obtaining screening from a practitioner with good training and lots of experience reduces these risks. Another risk can be a false negative test results. So screening test results may appear to be normal even though colorectal cancer is actually present. So a person who receives a false negative test may delay seeking medical care even if there are symptoms. Then also you can have false positive tests. These are screening tests where the results may appear to be abnormal even though there is no cancer present. So a false positive test result can cause anxiety, and it usually is followed by more tests such as biopsies, which also have risks. So in summary, colorectal cancer is a disease in which malignant cells form in the tissues of the colon or the rectum. Colorectal cancer is the second leading cause of death from cancer in the United States today. Age and health history can affect the risk of developing colorectal cancer. Studies have shown that these screening methods for colorectal cancer help decrease the number of deaths from the disease, and we've talked about these: the fecal occult blood test, double barium contrast, sigmoidoscopy, and colonoscopy. The new screening tests that are being studied in clinical trials are promising. So stay tuned for more on these as the science behind them develops. Those were the virtual colonoscopy and the DNA stool testing. But the bottom line is that colorectal cancer screening is recommended by the National Cancer Institute, the American Cancer Society, the U.S. Preventive Services Task Force, and other medical organizations worldwide. So if you're 50 years of age or older, or younger with other risk factors, it makes sense to have regular colorectal cancer screening. It's important, if you haven't done this yet, to have that discussion with your doctor soon. And as promised, I wanted to give you some more information about how to get where the resources are on this topic. So I'll leave this page up for just a minute if you wanted to jot down some of this contact information. The National Cancer Institute has either a toll-free phone number. They also have their live chat where you can actually get on the phone and speak with somebody during their recommended business hours. You can write to them. And then they also have a very nice website that provides online access to information on cancer, talks about the clinical trials that are underway, and other organizations that offer support and resources for cancer patients and their families. Additionally, we have some resources for you right here at Loveless Health Plan. We have telephone counseling for weight management and tobacco cessation. And there is some evidence that both of those issues, tobacco and overweight and obesity, may be linked to certain kinds of cancers. We also have online tools, including personal health assessment, consumer health tools, and health education. We have wellness discounts through our Choose Healthy program on the website. And of course, we have all of our monthly webinars. So when you get a chance, please go to our website at lovelesshealthplan.com. Click on the Wellness Center for more information about our Healthy Steps program offerings. Now, our April topic for the webinar is substance abuse, what you need to know. So thank you again for participating today. If you have any questions about our webinar, please email them to our healthysteps@loveless.com. And please do take a moment to complete the evaluation you'll be receiving via email. We really do use your feedback in our efforts to improve our programs for you. Remember to check our website regularly and register for any upcoming webinars on other health topics. Thank you again,